The purpose of a recumbent examination is to detect the source of pain or lameness. Detailed limb examination can be performed with the animal standing or recumbent. Smaller dogs and cats may be more relaxed when palpated standing. Large dogs are usually calmer when examined recumbent. The general principle of this part of examination is to go from distal to proximal and from normal side to the abnormal side. The reason to evaluate the limb from distal to proximal is that you can't extend the proximal joint without extending the distal joint. For example, you can't extend the elbow joint without extending the carpal joint. Similarly, you can't extend the shoulder joint without extending the elbow joint and the carpal joint. Therefore, it is hard to differentiate carpal pain and elbow pain if you extend the elbow joint first. Similarly, you can't extend the stifle joint without extending the tarsal joint, or extending the hip joint without extending the stifle joint and the tarsal joint. Be sure that the reaction you palpated is repeatable and painful, and not just the animal getting annoyed with the examination. The pain reaction that you may notice would be pulling the limb back, yelping, stop panting, and facial expressions such as licking or tensed skin. Thoracic limb palpation. With the help of your assistant, lay the patient on the side. First look in between the foot pads. You may look for wound, burn, or foreign materials such as foxtail. Examine the interdigital area for foreign material or dermatitis. Palpate the digit and look for bony or soft tissue swellings. Flex and extend each individual digit to check for joint pain. Perform bone palpation of the metacarpal bones. Use a firm, steady compression to help you identify pain or swelling. Flex and extend the carpal joint. Feel for crepitus and look for pain. In normal dogs, you should see the foot pad touching the antebrachial inflection and 5 to 10 degrees of extension in carpal joint. With the carpal joint extension, check the integrity of the collateral ligament by opening the lateral and medial side of the carpal joint. With the carpal joint inflection, look for joint effusion by palpating the cranial part of the radial carpal joint. In a normal dog, feel for concave space between radius and radial carpal bone in normal carpal joint. This area should be flat, the bony margins should be readily palpable, with no swelling present. Move your hands proximal to palpate the radius and ulna. Apply a firm compression to the radius and ulna individually to feel for swelling or pain. If you detect pain, note the anatomical location of the pain identified. Pain associated with osteosarcoma occurs more commonly in the metaphyseal region, whereas panostitis occurs more commonly in the diaphyseal region. Feel the medial and lateral humeral epicondyle and the normal contour distal to medial and lateral epicondyle. Dogs with thickened joint capsule from elbow arthritis will lose the normal contour of the humerus distal to the epicondyle. Feel the recess between the humeral condyle and the ulna. You should feel a V-shaped, distinct recess. Swelling and distortion of this V-shaped recess will indicate joint effusion or of the elbow joint. Flex and extend the elbow joint. Feel for pain, crepitus, and effusion. Pronate and supinate the elbow joint with the elbow in both flexion and extension. In dogs with elbow dysplasia, you may elicit palpate the humeral shaft and check for pain or abnormal swelling. Note the normal sigmoid shape of the canine humerus. Put one hand on the scapula and the other hand behind the distal part of the humerus. Extend the shoulder joint and flex the shoulder joint. With the shoulder joint flexed, extend the elbow joint. Palpate over the area of bicipital tendon origin. First feel the greater tubercle of the humerus, then move your finger medial and slightly proximal. Pain and compression on this area indicate primary or secondary biceps tendon pathology. Feel the scapula. Palpate the cranial border and caudal border of the scapula. Palpate the acromion process and follow the spine of the scapula. Look for pain or abnormal swelling. Feel the top border of the scapula. With one hand on the scapula and the other hand on proximal humerus, try to shift the scapula dorsally. Note the amount of the dorsal deviation. Put your hands around the axillary region to feel for enlarged lymph node or pain. Finally, gently pinch the toe to elicit withdrawal reflex. Observe flexion activity of the carpus, elbow, and shoulder joint.